16th branch of Megamart and Macromart supermarkets in Bahrain has opened in Sahala. The best offers are available to the customers at affordable rates. Everyone is welcome. During and around the opening day, a variety of fish including salmon, meat and dairy products, roastery, frozen items, food and non-food items, groceries, fruits and vegetables, electronics, garments and ready-to-eat food items are available to the customers at affordable rates. Hearty welcome to all. Megamart and Macromart, your favorite shopping destination.
The exclusive franchisee of Cochin Kala Bhavan in Bahrain, with over a decade of existence in Bahrain. Exclusive online regular classes have started for classical dances, music vocal, instrumental music, cinematic dance, Kathak, Zumba body fitness, karate and yoga, drawing, arts and craft, children's theatre. For more information, please call 3909 6845 3909 4806 3885 2397 or visit www.bahrainmediacity.com. Since 2006, Magnum Imprint have been offering high standards of quality with our professional team that delivers all your advertising and promotional requirements efficiently and promptly. For more details, please contact 39887088 or 33856330 or 33542530.
Good evening viewers, welcome to yet another episode of BMC Pravasivision, KIMS Health, Dr.LIVE. Today's topic is tonsils and adenoid surgery. We have with us Dr. Rijo Jayaraju, a famous ENT surgeon from KIMS Health Hospital, Hassan. He is specialized in micro ear surgery, endoscopic sinus surgery, tonsils and adenoid surgery, and endoscopy of nose and the larynx. Welcome, doctor.
Thank you.
Welcome to today's episode. Doctor, we have a lot of doubts about tonsils and adenoid surgery. Doctor, can you please explain what are tonsils and adenoids and what are the functions in their human body?
Well, this is a very common doubt asked by most of my patients, and even especially when children come to me, their parents are the ones who are more anxious and they have a lot of doubts regarding tonsils and adenoids. Tonsils and adenoids are basically lymphoid glands in the body. So there are around 600 lymph glands in the body. So these are the glands which are responsible for immunity in the body. So in the head and neck or behind the nose, there are certain chains of glands which is otherwise called Valdes ring. So these tonsils and adenoids form a part of the Valdes ring. So adenoids are basically organs or lymphoid glands in the nose, or you can say specifically in the back of the nose or behind the nose. So those are the adenoids, whereas tonsils are also lymphoid glands along with the adenoids in the Valdes ring, but they are present behind the mouth, or you can say exactly in the throat. So there are even other two kinds of lymphoid glands like tubal tonsils or palatine tonsils, lingual tonsils. So all these are tonsils or lymphoid glands which form a part of this Valdes ring. So basically the main function is to aid in immunity like all the other lymphoid glands in the body.
Okay, doctor. Let us now talk about adenoids. What are the causes for the adenoids to be removed by surgery?
Well, the commonest age group in which adenoids are enlarged, or patients who present with an enlarged adenoids, are children, pediatric age group. So it can be even from a child who is a few months old to a child who may be 12 or 13, because see, up to 16 is what we consider as pediatric group. So it can be up to that age, or even sometimes rarely we see in adults also enlargement of the adenoid glands. So why or when is the surgery required is the question. So the main problem that happens when the adenoids get enlarged is it blocks the airway, or it blocks the nasal airway. So when the child or when the patient breathes, the air which has to come through the nose or through the nasopharynx, the area behind the nose, that is called nasopharynx. So when the air passes, the adenoid is a huge tissue that forms the posterior wall or the back of the nose, which is otherwise called the nasopharynx, which actually blocks the airway, and thereby the child has something called obstruction or obstructive airway disease. Okay. So in mild forms we usually treat by medicines, like we give anti-allergics, because allergy is one of the cause of this enlargement, or else sometimes we give even nasal sprays to help in control allergy. So if it is mild degrees like grade 1, or we have a grading like grade 1, 2, 3, 4. If it is a grading of grade 1 or 2, we can usually treat by medicines. But if it is something which is very significant, or grade 3 or grade 4, which actually obstructs the airway completely, it leads to other complications, like the child can have something called obstructive sleep apnea. That is, when the child sleeps, the child will have a complete blockage in the airway, which is otherwise called OSA, and snoring. And then the other symptoms which can be that when the child can have some deformities in the face, the jaw can protrude out, the upper teeth can protrude out. So all these are some of the commonest symptoms in children who present with an enlarged adenoid. So how we diagnose this is by usually clinically by an X-ray or an endoscopy, because we cannot see the adenoid tissue by examining the nose or the throat. It is exactly behind the nose and above the throat, so it's in a hidden area. So usually for children I take an X-ray, because endoscopy children may not cooperate, but endoscopy is one of the most and the best diagnostic tool for enlarged adenoids. So then coming to the enlarged adenoids of around grade 3 or 4 and causing an obstructive sleep apnea, that is one of the commonest indications why we perform an adenoidectomy surgery.
Okay. Doctor, I have heard that adenoid problem can cause problems to your ear and the hearing capacity. Is it true?
Yes, exactly. So like I said, the adenoids are located at an area, and on either side of the adenoids we have an opening called the eustachian tube, which is actually the connection of the nose to the ear, or the nasopharynx, or the part behind the nose to the ear is being connected by a small tube called eustachian tube. So an enlarged adenoid can block the eustachian tube, thereby it causes a negative pressure within the ear. So usually in a child having this obstructive symptoms, snoring comes with a hearing loss. That is how the clinical presentation is. And the main problem with this is most of the children will be in the age group of 3 to 6 years old, and the children cannot say that they can't hear. And sometimes the parents also may not even realize that the child is having a hearing loss. So we have to put the child to some basic investigations like a tympanometry, which is like a pressure check in the ear to diagnose the fluid, any fluid in the middle ear. So when the opening of the eustachian tube is blocked, that causes a negative pressure in the middle ear, and that causes a collection of fluid within the middle ear. So when a fluid collects in the middle ear, the hearing capacity is reduced, because the bones which are responsible for conduction of sound from the external ear are basically blocked. The movement of the bones are blocked by the fluid. So that's how the hearing loss presents in children.
Doctor, can you explain the difference in adenoids between children and adults?
Yes. So as I said, in children, when the adenoid is enlarged, most of the time the parents are the ones who give the history. Parents are the ones who have to realize that my child has a problem with the adenoids, and then bring the child to the doctor. And even hearing loss also might be most of the time missed. Some of our doctor colleagues only miss those hearing problem in children, whereas in adults the history and presentation is easier. But then the major problem in adults is not that, because when an adult comes with the similar symptoms, it can be adenoids, but again it can be many more things other than adenoids, like a tumor in the nasopharynx. In the place of adenoid there can be a tumor. For example, if it's an adolescent child, it can be a tumor called nasopharyngeal angiofibroma, but usually the child will have bleeding from the nose. Or if it's an elderly adult, it can be something like even a cancer in the nasopharynx. So these are some of the differential diagnosis. We say differential diagnosis because in adults, when an adult comes with a similar symptom, there can be other diagnoses which also should be thought of. So that's a basic difference between presentation in an adult and a child.
Okay. What are the methods of surgeries of adenoids you adopt?
So there are basically three methods of surgeries which we commonly do in our hospital. The first is the conventional method. So adenoid surgeries are done through the mouth. So many of the patients have a doubt, doctor, how do you do the surgery when it is behind the nose? Do you cut open the nose? No, we don't cut open the nose. The surgery is basically done through mouth itself by using specific instruments, and we use something called a curette or adenoid curette, which is the conventional method, the traditional method for adenoid surgery. So that is being done in our hospital. And the second method which we do is with the help of endoscope. So endoscopic adenoidectomy with the aid of an instrument called debrider. So we endoscopically view the adenoids through the nose and we operate the same through the mouth. So we use both the passages for the surgery. That is called endoscopic adenoidectomy with the micro debrider. And the third one which we commonly do is endoscopic adenoidectomy again, but with a coagulator. So coagulator is a newer instrument which we use for surgery, which the advantage is that the bleeding in coagulation surgery is very minimal and very less. So these are the three common methods we use for adenoid surgeries.
Okay. What are the possible complications of adenoid surgery?
Well, in adenoid surgeries, the complications are very, very less. Maybe you can say less than 1%, because with the aid of these newer techniques, like I said, endoscopic surgeries, the complications are, you can say, maybe less than 0.1%. But in conventional adenoid surgery, sometimes there can be an injury in the eustachian tube and thereby causing an edema or a temporary ear block can happen. That is one of the complication, or sometimes injury of the posterior pharyngeal wall or the wall behind the structure behind the adenoid. So these are some of the commonest complications, but again that is very, very less. You can say in an expert hand, the complications are almost negligible in adenoid surgeries.
Now let us discuss about tonsils.
Sure.
What are the reasons for the tonsils to be removed? In
children and in adults, we can classify it into two. Tonsils in children and adults. So first I'll go into how the presentation is in children. So usually children, along with adenoids, they will have a tonsillar enlargement also. So the child usually will present with recurrent infections, upper respiratory infections, or around the year the child will have a cough and cold. So as per the textbooks, we say that if there is a recurrent infection, repeated infections in the adenoid and tonsil, that warrants for a surgery of the adenoids, or the tonsils. So recurrent as in, for example, a person has infection of at least 7 times in a year, 5 times in 2 years, 5 times per year for consecutive 2 years, or 3 times per year for consecutive 3 years. So that is as per the textbook. But practically speaking, if an adult or a child has an infection which requires them to take antibiotics very frequently, which leads them to be hospitalized sometimes, also a condition in which they are unable to go to school or work, that affects their productivity and quality of life. So all these are indications. So again, though we say 7, 5 and 3 episodes as per textbooks, it is very individualized and personalized when it comes to the decision of making a surgery. And the second thing is the enlargement of adenoids, when the tonsils. When the tonsils are enlarged to, again we have grading of grade 1, 2, 3, 4. When the tonsils are enlarged of grade 3 or 4, that can actually block the airway as well as the food passage. In adenoid it was only the airway, but in tonsil enlargement it can even block the airway, causing an obstructive sleep apnea, snoring symptoms, and also it can result in difficulty in swallowing for many of the children as well as adults. So that is one more indication, the enlargement, the size of the tonsils. And the third one is something called peritonsillar abscess, or otherwise we say quinsy. That is, sometimes when the tonsil gets infected, usually on one side we see a collection of pus. So at that time the patient will come with high grade fever, and the patient might require a small surgery to even remove the pus, may require hospitalization and antibiotics. So if a patient presents with a peritonsillar abscess, usually for a second time, then we usually advise surgery because it can again happen. So a second episode of peritonsillar abscess is one of the third indications which I say for surgery. So these are the commonest indications, and then when there are many other indications or reasons why tonsillectomy surgery is performed.
What are the techniques of tonsil surgery?
So again, as we discussed with the adenoids, even tonsillectomy has got a conventional technique called dissection and snare method. Like again, the surgery is done through mouth itself. We don't use any incision over the skin. It is just with the open mouth that the tonsillectomy surgery is done. So conventional methods are there, dissection and snare method. Then we have other newer methods in which we use specific instruments called electrocautery, monopolar and bipolar cauteries, in which the dissection is very easy, the removal is very easy, and bleeding is very less. And even the latest techniques like coblation tonsillectomy, in which we use an instrument called coblator, in which the bleeding is very minimum, or you can say negligible. And some places even laser device is used to dissect the tonsils. So these are some of the newer techniques in tonsillectomy.
What are the possible complications of tonsil surgery?
So when it comes to tonsil surgeries, there are chances of bleeding. That is the commonest complication, because even after the surgery, for the next 24 hours or for the next 7 to 10 days, there are chances that the patient can have bleeding, which is also very rare. You can say maybe less than 1%. But there are chances that the patient can have bleeding after the surgery. That is because we deal with small blood vessels or arteries during the surgery, and sometimes it can cause a slight bleeding after the surgery. And some patients can have pain after the surgery, but with the newer techniques of dissection and also with the newer methods of treatment post-operatively, like antibiotics and even analgesics, the complications of severe pain after the surgery is very less. But most of the patients can have a slight pain from the 3rd to the 5th post-operative day after the surgery. but again that is also not very severe, that can be managed at home with medicines usually.
Okay, doctor. What is the recovery time after the surgery of both tonsils and adenoids, and what advice do you give the patients after the surgery?
So after the surgery, we usually discharge our patients. If it is only adenoidectomy, I discharge my patient on the same day. Suppose a patient comes in the morning, gets operated, and they go home in the evening. Tonsillectomy also, they can go on the same day if there is not much of pain or bleeding. Some patients we keep them for the next day and discharge. So there is no question of more than 24 hours of hospitalization following a tonsil or adenoid surgery. And then after the surgery, the patient is usually advised to take soft diet, preferably cold juices and ice creams. That is because these can reduce the bleeding as well as it can cause a soothing effect so that the pain will be reduced. So that is the dietary advice we give. So up to the third day, usually I advise the patients to take a soft diet, and then from the fourth day itself, they can start a normal diet. And even those who are working can resume a normal work schedule after the fifth day usually. And if it is only adenoid surgery, usually even children are advised to go to school after the third day. So these are as per what we said in the post-operative advice for the patient. And then you were asking some other.
Yeah, it's a common doubt that after the surgery of tonsils and adenoids, our immune system will be affected. Is it true? Is it a fact?
Well, that is a very common myth, because when most of my patients come to me for surgery advice, they ask this question, but that is actually a myth. See, basically, like I said, tonsils and adenoids are lymphoid glands in the body. So when these lymphoid glands in children, it is required for your immunity, but they are just 1 or 2 or 3 of the 600 lymphoid glands in the body. So it is like you remove a cup of water from the sea. So it is not going to affect immunity at all. And then why is the surgery required in some of the children is because when children get infection, especially when children get infection, the bacteria get trapped inside the gland, and the child goes to a doctor, takes antibiotics. For a few days, child is fine, but again the infection recurs. So what basically happens is the bacteria which get trapped in the gland stays there, and usually the infection keeps recurring. That is one of the reason why the infection keeps recurring. So until and unless the surgery is performed in some of the patients, I'm not saying all the patients, some of the patients, until and unless surgery is done, it is not going to help in complete recovery of the patient. It's just a myth that surgery can reduce immunity. It is not at all true.
It is not like
not
that.
at all
Okay.
true.
Then doctor, any takeaway message for our viewers, please?
So thank you so much for the wonderful questions, because I think I was also able to answer many of your doubts, which will be also helpful for many of our viewers and many of our patients. So as a take-home message, I would like to tell our viewers and our patients that adenoid and tonsils, though it is a very common problem, some patients are not diagnosed on time. That's why we have children who come to us even today with problems of hearing loss, permanent hearing damages, again which can be because of recurrent infections of the adenoids. And even we have patients coming with huge abscesses or pus collections in the neck because of recurrent infections of tonsils. So though these are very simple infections, or it may look very simple, it must not be ignored. I advise all my viewers to seek the help of a professional as soon as you have any of these kinds of infection for yourself or for your family members. Thank you.
I hope this episode is quite informative. We will be back with another episode and a new topic. Till then, this is Jasila Mujib signing off.